Good day, everyone. It's time for question number 26 here. This is a question that was emailed to me yesterday, and essentially it reads, um, the person was looking for comments on how to communicate with someone who cannot verbalize pain secondary to head neck cancer related dysphagia, utilizing a model that this person had learned from another, I guess, education line in terms of releasing the assorted muscles, et cetera, based on physiologic deficits after imaging. So lots of different approaches for myofascial release, lots of different approaches for manual therapy in general for the laryngeal region, the mouth region. I'm I'm a staunch proponent of establishing a communication-based feedback loop with my patients at all times, allowing them to be um, a big contributor to determining what's relevant versus me um, doing it based solely on my touch, based on my experience, based on my training, which I don't mean to minimize or downplay that at all because our training is important, but sometimes that gets based on our I'm going to call it ego. The ego gets in the way, thinking that we feel something that's tight and therefore it must be released. And sometimes that's really valid. I spent the first half of my manual therapy career, at least, with myofascial release using that sort of approach, where I was considered the expert. But I'm more and more, whenever possible, I want to establish the patient's determination of whether something feels important or relevant. I've got a patient right now who's head and neck cancer, total laryngectomy, and um, minimal communication at this point. He has just told me that he's beginning to hear his words, hear himself speak, which was a kind of a breakthrough for him and a nice place to be, but unintelligible speech even with the electrolarynx. But one of the things that I pay attention to is I'm not just trying to elicit pain or have them warn me about pain. There's a lot more nuanced communication that I look for with my patients. It could be something that feels good about what we're doing, something that feels relevant or useful or hopeful about what we're doing, whether it's just the palpation, the stretch, the touch, the pressure, or the interaction itself. Not just the communication of pain, and yeah, that's certainly important because I certainly don't want to be taking a person to a place of feeling pain. Pain is present sometimes, but it should be taking the person to the edge of awareness of a sensation of pain and not just hurting them. All right. So, what do I do with the person who lacks that communication, who can't speak, or maybe from a cognitive level isn't able to communicate even if full speech abilities were there and therefore writing abilities aren't there? I rely exceedingly strong on nonverbal communication, facial, eye movements, that sort of thing. It's not perfect, but when we're working in patients who can't fully communicate, there is a sense of compromise. There's a sense of getting to know each other with any new patient, and whether it's a pediatric or geriatric, whether it doesn't matter what the diagnosis is, I still need to figure out who this person is and whether they're communicating properly, they're making their needs known, and that's that they're being honest with me too. That's to me a big thing. So it's never a perfect world, but I'm going to work to establish a fairly nuanced level of communication with everybody I see. Could be through nonverbals, could be through verbals, could be through hand signals, plus or minus, right? Does that feel good? Is it somewhat familiar? I'm going to spend time with that person. Sometime the first session or two, we may just spend on working out ways to communicate, making sure they know what I'm looking for, not just pain, but other things, positive things that feel good about it. And then we move on from there. And yet, it's never a perfect world our patient lack communication, but that's the reality of the work we do. And I do encourage anybody else, if you've got questions, send me an email, and I'd love to make them part of this series.